We have chosen Mary Cooper's case, and I will first begin by identifying her actual and potential problems. Mary's first actual problem is she is currently on St. John's wort. However, this interacts with fluoxetine. Both increase serotonin levels, hence increasing the risk of serotonin toxicity. She is prescribed 40 milligrams fluoxetine for depression. However, recommended initial dosage is 20 milligrams per day and should not be increased unless minimal improvement is observed. Her second problem is she is currently taking 4 puffs of salbutamol in one session, which is equivalent to 400 micrograms in a short period of time. Her prescribed dose is 100 micrograms per actuation, 2 puffs daily when required. This shows that she has double the recommended dosage at one time, resulting in palpitations. Thirdly, diclofenac increases the risk of bronchospasm in asthma patients. Diclofenac and beclomethasone interact when taken together, as the combination of the two greatly increase the risk of gastrointestinal complications. Fourthly, Mary has been experiencing severe stress and insomnia since starting her new job, as well as feelings of desperation and inability to cope. This has caused her to lose her appetite and has lost 4 kilos within the last month. Lastly, Mary smokes about 25 cigarettes daily. She is an asthma patient also, hence increasing the risk of not responding to beclomethasone and may require an increased dose. Mary's first potential problem is if she continues to self-administer double her prescribed dose of salbutamol, she may become resistant to the medication, making the asthma harder to control. Her lungs may also become hypersensitive. Secondly, if Mary continues taking diclofenac and beclomethasone, the interactions between the two could lead to gastrointestinal complications, such as nausea, vomiting, GI ulcers, GI hemorrhage, and anorexia. Thirdly, if Mary continues to use fluoxetine and St. John's wort together, the combination of these two may result in a condition known as serotonin syndrome, which is life-threatening. Fourthly, when diclofenac is used on patients with pre-existing asthma, it can exacerbate asthma symptoms. If Mary continues to smoke, this will worsen her asthma as her breathing is already shallow and wheezy. It will also accelerate her loss of lung function. Fifthly, if Mary continues to drink 1 to 2 alcoholic beverages 5 days a week, this can worsen the symptoms of depression and the benefits of fluoxetine will not be felt with full effect. Lastly, if Mary continues to lose weight due to her work and domestic arrangements, this also has the potential to worsen her depression and insomnia.
So, I'm going to talk about some available options to resolve her actual problems. Firstly, we withdraw St. John's wort and wait a minimum 14 days to begin fluoxetine. And secondly, we educate patients the correct administration of salbutamol and to do not change prescription without any instructions. And thirdly, diclofenac interacts with beclomethasone and causes asthma exacerbations and bronchospasm. So we withdraw diclofenac and continue the use of beclomethasone to maintain her asthma symptoms. And then next, non-pharmacological and pharmacological therapies can be used to treat her insomnia. And then patient education to cease smoking to prevent further deterioration of her asthma. And last, alcohol can lessen the benefits of fluoxetine, so reduction of alcohol intake should be advised to maximize the effects of the medications.
A critical potential issue includes seizing her current combination of St. John's wort and fluoxetine. These 2 medications can lead to the development of serotonin syndrome. Hence, by seizing St. John's wort will decrease the risk of this condition and will not worsen her depression. Secondly, the use of diclofenac interacts with her asthma medication, hence should be seized as there are alternative options to treating joint pain, including non-pharmacological treatments. Mary's weight loss could be due to the use of fluoxetine. This antidepressant has a common adverse effect of weight loss, so it is recommended that fluoxetine is seized and a referral to a dietitian is given. Mary's addiction to smoking cannot be addressed until her mental health issues have been looked at, as it can result in the worsening of these conditions. Once fluoxetine administration has successfully begun, education on the effects of smoking on the body and strategies to assist in quitting should be undertaken. Mary should also be educated on her weekly alcohol intake, as it reduces the effects of fluoxetine. Juice that lowers cortisol levels could be an option for Mary to substitute with alcohol.
So I'll be talking about the therapeutic plans. So St. John's wort should be withdrawn as she is experiencing little to no effect, and fluoxetine should be continued. However, fluoxetine dosage was incorrect, and so dosage should be reviewed by the doctor. Mary has been prescribed 2 puffs of salbutamol twice daily for her asthma. However, she has been taking 4 puffs at once, which worsens her asthma, causing Mary to experience palpitations, shallow breathing, and wheezing. Therefore, patient education is advised. To resolve Mary's exacerbation of asthma induced by the interactions between diclofenac and beclomethasone, the use of these medications should be reviewed by her doctor and diclofenac should be ceased. Panadol Osteo can be used as an alternative to assist with her osteoarthritis. If Mary starts taking Panadol Osteo, paracetamol should be ceased. Non-pharmacological therapy for insomnia is sleep hygiene, which involves stimulus control, relaxation training, and cognitive therapy, and should always be used as a first-line treatment for her sleeping disorders. The first-line pharmacotherapy treatment for insomnia is administering temazepam. However, this is contraindicated in patients who consume alcohol, so melatonin can be administered.
Potential program. First program, when using fluoxetine, when arise adverse effect, then stop using it, and then seek doctor review immediately. Mary has been prescribed diclofenac 150 gram per day. However, MIMS recommended initial dosage is 100 mg per day for treatment longer than 4 weeks. After 4 weeks of use, notify doctor for the review. Mary recent weight loss of 4 kg cause of fluoxetine. Refer to other health professionals. Mary's habits of alcohol intake and cigarette. These factors contribute negative effectiveness of the drug, so that she needs to be educated to stop this habit. According to MIMS and OSDA, fluoxetine and St. John's wort are interacting each other and then cause undesirable adverse reactions, so St. John's wort should be ceased.
A psychiatrist, dietitian, and social worker. Psychiatrists tailor a client's treatment by focusing on the client's needs and concerns. Using their professional expertise, they grant their recommendations and can further prescribe medications to ensure the right drug is given for the right reason. Hence, this will be beneficial for Mary. It is reported that a small change in the client's diet can increasingly improve their well-being and relieve depression symptoms. Thus, by referring Mary to a dietitian, it gives the dietitian the opportunity to talk to the client and integrate a plan to modify her diet and provide the best outcome for them. A social worker can help with the social aspect of mental illness, such as providing support a client needs in terms of housing, work, and income. Additionally, social workers also evaluate consequences and impact mental illness has on their client, their family, and relationships, and from that they intervene where possible to reduce the effect of those consequences. To provide a patient-centered care, it is critical for all multidisciplinary teams to collaborate. By involving all the multidisciplinary teams listed above, a positive outcome can be expected for Mary.